At Children's here, we do two things. We do one is what's called animal-assisted activities. And in that case, we typically go around and visit the patients in their rooms. Sasha's a lover, and so she usually backs up, sits by the bed. Sometimes she lays on the bed and just begs for pets, as we frequently talk about dogs and their pets and their animals and so on. Also during the visit, she might be a distraction while somebody's getting a shot or somebody's getting a procedure done. But overall, she's just there to suck up a little loving, and in exchange, she'll give lots of loving back. We also volunteer in a PAWH program, which is working with therapists. And in that case, Sasha follows the lead of the therapist on working with various kids. And for example, we've worked with kids with eating disorders, and so Sasha had to, sometimes got to eat the same food the kid did. Maybe they needed to learn to brush their teeth, so they brushed Sasha's teeth. Maybe they had trouble dressing, so they practiced dressing Sasha, just combing, brushing, various tasks that you do in every day of a dog. Therapists use in accomplishing their goals in occupational and physical therapy.
I'm just grateful we have them here who can visit kids like this and help them be more at ease, give them some joy in the day, and it just, truly it is just the best medicine.
So I use the therapy dogs for inpatient, which is when I go over to the hospital and see kids that are in the floors, and usually these children are pretty acutely ill. It's really hard for them to want to get out of bed and participate in therapy. So when that happens and they're not really motivated to do anything for me, I usually bring up a volunteer and a therapy dog, because 9 times out of 10, they cannot wait to sit up, sit on the edge of the bed, pet the dog, give the dog treats, interact with the dog socially, and it's just a wonderful, wonderful experience for them. And maybe that's the first time they'll ever get up for me, is finally when they bring the dog to their bedside.
In Child Life, we strive hard to bring the outside in as much as possible, therefore providing normal growth and development. And dogs, for many families, that's what that does. It brings in normalization of what a child would normally be experiencing being out in society and with their family pets. So we relish therapy dogs. We welcome them every day and hope that more people will want to bring their dogs here that can offer that pure joy and that soothing relief, that sometimes that's the only thing will help. There's times I've been with kids for procedures when it's okay to have a dog there, and if they can just reach out and touch, that sense of touch, touching a soft dog, the anxiety level decreases in that child, and the families witness it and the staff witness it and know that it's very important.
I work a lot on pretty difficult skills, whether it's social skills or physical skills, and it's really fun to use the dog to actually do some of the skills like running and jumping, and even using the dog for obstacle courses, things that the dog does that the child wouldn't do for me, but they'll do it because they just saw the dog run down the hall and do it. So it's been really rewarding, and it's been great to build those social skills with the kids. You know, as they interact with the volunteer, they're gaining a lot of a really good social skills experience.
You just see their faces lighten up. It helps them through the day. I would say that the dogs and their owners, they make a big difference in how the day goes for that child. And wow, that's pretty significant.
When I got Jazz as a puppy from the litter, it was with the intention of him doing therapy work someday. And he's been delightful to work with. Since I've had him, he's been in training, some kind of training at some point all the time. And for this work, we went through the Delta Pet Partner Program. And the Delta program is rather intense training so that the dog is truly conditioned to work in this environment. They really test the temperament of the dog and really work with the handler, myself. Whenever you train a dog for anything, you're really training the human, because we have to direct the dog. And of course, the dog has to learn behaviors that will accommodate them to be able to function in whatever you're training them to do. If you have a dog and you think you'd be interested in doing some therapy work with your dog, I think that's wonderful. First of all, we need dog teams everywhere. Dogs bring such joy to people. But it would be important for you to have your dog socialized. If your dog is not socialized to other people and other dogs, that would make it very uncomfortable for your dog. And you can tell that if your dog gets excited around people and doesn't settle and may even appear to be aggressive-like in their behavior. That's not a good candidate for therapy work. And your dog also needs an abundance, not an abundance, but a really good solid foundation of obedience training. A typical day for Jazz and I at Children's is just getting from the car to the volunteer office with all the people who stop us and talk to us. The maintenance guys, the doctors passing by, the people checking out to go home, the utility workers and other nurses. Everybody wants to know what kind of a dog he is, and many people who are dog lovers, of course, want to pet him. And the Children's Hospital program, volunteer program, is outstanding. We just truly enjoy being a part of this program. We feel like we have an investment in it. We feel respected, honored. We feel very much a part of the program and valued, and that's so important. They really do value all their volunteers, human and the four-legged kind.